for an opening statement. Today, we're here to critically examine two proposed regulations from the Biden administration that threaten to disrupt care for millions of seniors and people with disabilities throughout the country. The proposed minimum staffing rule would require nursing homes to have a minimum number of registered nurses and nurse aides, while the Medicaid access rule would require home health agencies to pass through a minimum of 80% of all payments to the direct care workforce. While well-intentioned, these rules are misguided and will ultimately threaten to undermine access to vital services that our most vulnerable rely upon. The success of our long-term care system is integral to the success of the broader healthcare system. Caregivers are the backbone of our long-term healthcare system, providing around-the-clock care and oftentimes undertaking physically intensive work to support our loved ones. We're at a critical juncture for our long-term healthcare system. Since the start of the pandemic, we've lost hundreds of thousands of workers from nursing homes, as well as home and community-based services. Nationally, there have been more than 500 long-term care facility closures since 2020, and the industry needs to fill 150,000 jobs just to reach pre-pandemic levels, while Americans continue to age and need more long-term care. More needs to be done. However, instead of partnering with Congress, the Biden administration is embracing central planning, claiming their proposal will lead to more workers being hired and help ensure safety. Unfortunately, this is far from reality. These one-size-fits-all, Washington knows best approaches will impose unfunded mandates on states and providers with reducing overall access to vital services without addressing the root cause of the problem. Regarding the minimum staffing standards, analysis from the Kaiser Family Foundation found that as many as 80% of nursing homes would not be able to meet its requirements. Separate analysis found that the mandate will cost Kentucky long-term care facilities $69 million annually just to come into compliance. Even the Obama administration agreed about the harms of racial requirements, concluding in 2016 that this policy would stifle innovation and wouldn't improve quality and lead to the elimination of jobs. I had a long-term care administrator in Barron County say our rural area in South Central Kentucky simply does not have access to additional workers. The lack of providers that will result from this requirement will result in no options for long-term care services. The Glasgow and Barron County market has 5 nursing homes and an acute care hospital competing for the same registered nurses. America's seniors and future generations deserve solutions that will increase access to affordable, high-quality health care. I will continue work as the chair of this subcommittee toward achieving those objectives. I will submit the full statement. I just read excerpts from my full statement for the record, but I will yield to my friend, Mr. Pence from Indiana.
Thank you, Chair Guthrie, for yielding